evening. Good evening. I would like to welcome you tonight to I Thrive Live. And just as a way of introduction, I'd like to let you know a little bit about Thrive. Thrive is a collective of exceptional, forward thinking women dedicated to effecting positive change in Terrebonne, Lafourche, and nearby parishes. Through impactful programming, Thrive aims to inspire individuals to lead healthier, more prosperous, and purposeful lives by delivering volunteer services, education, raising awareness, and providing resources to address specific needs within our local communities. All in all, we are transforming our communities, promoting health equity, revitalizing target areas with innovative programming through volunteerism and empowerment. This is Thrive. And our topic for tonight is women in health and well-being. So we have a few ladies who are members of Thrive on with us tonight. We have Brandy Adams, who's with Phoenix Yoga with Brandy. We have Janelle Short, who is with Grace Fit Personal Training. And we have Dr. Kana Stewart, who is a pharmacist. So ladies, good evening. I would like to start with a few questions for you, and anyone feel free to contribute to the conversation. So the first is, how do you prioritize self-care in your busy schedule, and what activities do you find most rejuvenating?
Janelle, you want to take this one? Because I could think of a long list of things, but you go at it.
How I prioritize this for my clients. Um, I first of all have a deep conversation with my clients, and I get them to open up to me about wellness. I get them to open up about making wellness a priority. Because what I've noticed over the last 28 years of me being in health and fitness is that we take health and wellness and we put it on the back burner. We do not make it a priority. And it can be for various reasons that we don't make it a priority. It can be because we're working, it's family, it's school, it's children activities. And I also know that is a lack of education in our communities. That's why we do not make it a priority. Especially, I just want to say, in an African American community, it's like 4th, 5th, 6th, 7th, 8th on the list. So what we need to do is, and what I'm trying to do is, and I'm so glad to be a member of Thrive, is to educate our communities on why it's very important to make this a priority. Because overall, it's about wellness. It starts from the inside out. And I'm gonna let somebody else elaborate on it because I can go on and on and on. But we have to know and understand that health and wellness and making this a priority is about, first of all, accountability and education, and getting our community to understand why health and wellness, well-being is very important. I'll elaborate on that hopefully later in the segment.
Thank you so much, Janelle. So it looks like one thing we need to do is to rework our priorities and kind of reorder this list. So that way everything on the list continues to flow for the well-being of ourselves as well as our families and our professional obligations as well. Does anybody else have any other comments regarding that?
Absolutely. Janelle, thank you so much for the work that you do, for providing not only a community jewel for physical fitness and wellness, but you have some awesome resources on nutritional guidance and simple movements that are accessible to everyone. Just being who you are and adapting this lifestyle for, like you said, the past 20 some odd years. First of all, I want to just give you kudos for that, for saying yes to your health and for bringing others along with you for the ride. And that's what I want to do. That's what I aim to do, following the footsteps of women like yourself, of women who have said yes to health, and who prioritize with actual attainable goals. You gave me a tip that stays with me. You said, that we needed to prioritize protein in the body, over sugar and carbohydrates, how the body crashes. You were like, if you eat a banana, put some peanut butter with it. And I was like, you know what? That sounds real good. I've never been banana and peanut butter type, but Janelle told me that, and that was enough. And that replaced my afternoon needing, coffee and things like that. So just those kind of little tips and nutritional guidance, along with a healthy amount of movement in a day, and a good spiritual life with practices in prayer and meditation, and mentally exercising the brain with journaling and asking questions. All those things fit together to address the whole person. And I agree with you that in our community, we often give so much of ourselves to everyone else, to our children, to our loved ones, to everyone, that we forget to prioritize these things as simple as hydration and healthy amount of movement and exercise. We are tired, and many of us have more than one hat that we wear, more than one job that pays us, more than one career path that we're taking just to look like our version of life. We have to stop and take care of ourselves. And I appreciate you for setting for running the race and setting the tone for what that looks like, especially for women between the ages of 18 and 60.
Brandy, I'll piggyback and say this. I've been knowing Janelle for a very long time, and she's always modeled health and wellness. I remember her walking around with peanuts, and I was eating a Snicker, but she was just eating the peanuts. And I was like, oh Lord, what am I doing wrong here? But, all in all, with prioritizations in our lives, you think about us as women, like we give, and we give. Like we give all day at our jobs. We give all day when we come home as mothers, as moms, as spouses. And then we forget to take care of ourselves. And so just getting that prioritization to take care of our bodies is going to be most important. And that's something I feel like women, especially women of color, I think. And Janelle, you could probably see, because when you look at the demographics in the gyms, like you see that we're neglecting our bodies, but we're taking care of everything else. So, how, ladies, how are you getting it in? Am I a morning person? Not. So I usually, if I do a walk, it's going to be in the late afternoons, but, making sure that we make time in our busy schedules to take care of ourselves. I think that's going to be of the utmost importance.
Yeah, this is the long game. This is the long game. This is not the quick fix that's so appealing. This is not a crash diet, a yo-yo dieting lifestyle. This is not a plastic surgery lifestyle. Put a Band-Aid on it and fix it with the outside. This is not a cosmetic or a superficial sort of thing. This is life and doing life well. And it matters on so many different little changes that you can make in your routine every day.
Absolutely.
Absolutely. Very good
and
tips, ladies.
You get so wrapped up in being a strong Black woman that you forget that you can't pour from an empty cup.
That's it, Dr. Kana. That's it.
Exactly.
Definitely so. And ladies, we've given a lot of talk to, making sure that we take care of ourselves and our physical health. But what about mental health? I mean, of course, all of this sort of coincides and works with each other. And, we all know that to be our physically best selves, we need to have be our mentally best selves, and vice versa. But definitely, as we all know, we definitely need to put more focus into the mental health awareness as well. So, Brandy, can you share any particular experiences or insights that you have regarding mental health awareness?
Yes, ma'am. Just this last weekend, unfortunately, I was in a terrible car accident driving along the highway just after my morning gentle yoga flow practice. So I was very calm. I I was driving a little too fast. I was going about 55 miles an hour when the water took me, and my car would not, it hydroplaned and my car wouldn't correct itself. And before I knew it, I flipped over in a ditch. And I kid you not, everyone that has been in a car accident, I appreciate now what you've experienced. My first thought was just, it's in God's hands. This is out of my hands. Lord, take the wheel. And I thought, when is the car going to stop? I need to breathe. And that's something that I learned through practicing yoga, but also with therapy, having regular therapy sessions with a trained professional that reminds me of the importance of deep breathing. So immediately I began to take deep breaths in and out of my nose to calm my heart rate and to stop panic from settling in. And so I think that because I practiced these things, I had a little insurance in place for myself, a mental insurance and a physical insurance. The spiritual part was not my battle. That was all up to God. But I walked out of that accident very well, healthy and whole and of right mind. And all I could do was lay prostrate on the ground and just be thankful. I had an extreme amount of gratitude for life at that moment. And so my daily practices involve some sort of movement, some sort of spiritual connection with my creator, my God, and some sort of mental connection with myself. I journal, I like to doodle, and I like to create things to just exercise my brain. And so I go to therapy regularly. I see a therapist at least every 2 months, and she provides me with resources I wouldn't have ever thought of for myself. And so I think that it all sort of fits together when moments like the one I had just the other day happen.
Absolutely. And I definitely, we're so grateful that you are okay. When I first heard about your accident, I was thinking it was a minor fender bender, but then I saw the pictures, and it's, you were truly lucky to be alive. And as you said, thankful to your creator, and he endowed you with the spirit and the tools and the wherewithal to remain calm in that situation. So I think it is very important that we, maintain that focus of mental health and spiritual health awareness as well. And along those lines, we also would like to talk about work-life balance and how do you maintain, healthy relationships and incorporate exercise within your everyday work-life balance, given the demands of what we all have to do on a regular basis with home and work and families and children.
Well, first of all, we have to make sure everybody should have a goal. Everyone should have a goal. You have to remember we all have different lifestyles, and what worked for me may not work for you. Okay, I may be able to run 8 miles. You may be able to walk a half a mile. Okay, it's not about how much or how long I'm exercising. First of all, exercising is not an option. It's not optional. Okay, because if you have a sit down job and you're at your computer all day, you may say, okay, Janelle, but I can't move around. Okay, as a trainer, as a fitness professional, I'm going to say, okay, I need you to get out of the chair. I need you to walk to the water fountain. Okay, cardiovascular is very important. Okay? It's not optional. Okay, we have to think about it like this. We all have nice vehicles. Okay, that vehicle needs water, gas, and oil. It's not optional if that vehicle has gas, water, or oil, because it is essential. Okay, cardio is essential. It's not optional. It doesn't matter if you do it for 15 minutes. It doesn't matter if you do it for 5 minutes, because from that, you're going to build on that. Okay, some of us work 12-hour days. Some of us work at home. Some of us may not have the opportunity, we may not work at all. But what you have to do is, just like you have to prepare your meals on a daily basis, we, especially as African American women, we should pencil in activity. If you're not a runner, it's okay. Walk. If you're not walking, I don't care if you squatting, sitting up, standing up and down when you're watching television, when the commercials come on. I can't emphasize that cardio is not optional unless the doctor tells you you have problems with your knees or if you're having problems with your heart. I'm just a no-nonsense trainer, and my goal is to get everybody moving, because just like Brandy said, mentally, if you exercise, you have mental clarity. You have mental clarity. Our process of thinking is clearer. We can make better judgment when we move. Okay. A lot of things go on when we exercise. And if anybody have problems with, okay, Janelle, I don't have time, all you have to do is just call me. I can help you with that time. And you don't have to be in a gym to do cardio. You don't have to be in gym to weight train. You don't have to be in a gym, have a gym membership to move. My thing is, my goal is especially to teach and educate African American women. We need to move. We need to move. We definitely need to move.
This is Tanya, Janelle. So, like, this is not rocket science. You've been preaching this for over 20 years to us. And I'm speaking specifically to our brown and Black women out there. What is it with exercise and Black women? What is it? You got to give it straightforward. Give it to us straightforward. What is it with Black women and exercise?
Okay.
Is it the hair? Is it the hair? Because they got some things out there. Is it the hair? Like, what's going on, Janelle?
It's our, and I had a discussion with the client today. It's the hair. First of all, it's culture. When we were coming up, our grandparents and our parents, what did they do? All they did was work. Nobody was talking about working out, right? Mm-hmm. It was work, education. Work, education. That's what it was all about. It was never about, and I can't say never, but probably 1%, 5%, or whatever the percent is not great. We weren't we need to exercise. We need to exercise. Now, I've been doing it for 28 years. I've been to all kinds of seminars. I teach class. I've been teaching class for over 20 years. And ask me how many brown women are in my classes or in any class over the last 20 something years. It's no more than 5 every day, no more than 5. Because what we put our emphasis on, and I don't know if it's culture or my hair, okay? We put more emphasis on the exterior than the interior.
That's powerful.
We focus on how we look on the outside versus how we feel on the inside. If we handle what's going on the inside through proper food intake and nourishment, guess what? The outside is going to take care of itself, because if I eat better, I'm going to feel better. If I feel better, I'm going to move more. If I move more, guess what? Everything is going to fall in place. But I can tell you the stories I hear, it's not important enough, Tanya. Mm-hmm. It's not important enough. And then when we hear about it, the doctor have said it's too late, or you have to have surgery, or, we have to get to that point where it's detrimental before we move.
Yeah, like kidney disease, diabetes, hypertension. Yes. Help us out, Dr. Kana, like you, Dr. Elena. You guys hear this all the time. Like, and I want to talk to my Black women, including myself, because I certainly need to exercise more than I do. But, having these thought-provoking questions certainly makes me think, Tanya, what is it going to take to get you out there to begin walking, to begin taking better care of your body? What are your thoughts, Dr. Kana?
A lot of times it does take a diagnosis. People come in for the first time with diabetes medicine. They weren't feeling well. They went to the emergency room. All of a sudden, they have to buy a glucometer. They have to get test strips. They're starting on medication and they're wondering, what do I do next? They might have just come, maybe just got diagnosed a few hours ago and are just lost, and they're, maybe in denial, not sure what's the next step, not sure what to do. But definitely, what she was saying, you have to take care of the inside, take care of the outside, and make everything a priority as a whole. So
Mhm.
just one piece of the puzzle, you have that, you need everything to come together to be healthy.
Right.
Yeah.
And one thing that I've seen is that, as Dr. Keena said, and Janelle, if you start from the beginning, then you don't have to do a lot of the medications. But many times, what I see later in medicine is that once people have these diagnoses and these detrimental conditions, then they want to go back and say, well, what can, I'm going to eat better. I'm going to do this. I'm going to do that because they don't want to take the medicines. So, we need to try to make sure we can do this in the right order so that we don't have to get to the point of medications, because by that time you really need the medications. And then it's not the time to say, well, I'm just going to do this all natural without any medications, without anything that, the doctor and the pharmacist and everything is telling me to do, because that part should have been done prior to. So, that's very important just to keep in the back of our minds, because we all have family, friends, everybody that's been through a lot of these, conditions. And so we see what can happen. So it's very important to make sure that we look at that. And in my line of work, we also see it in terms of the reproductive health,
Yes.
when many times women may be struggling with trying to conceive a pregnancy or to even maintain a pregnancy. We really want to make sure that everybody is as healthy as possible prior to and going into these, life changing moments and things like that. So it's very important, again, to have exercise in your life, to have your mental and physical well-being optimized, and to come into this, as you can, as well as you can, so that way you're able to meet the demands that your body is going to have to go through with these various stages, and not just with pregnancy. It could even be with, menopause, or even in our younger ladies with menstrual cycles. There's a lot that we can do in terms of lifestyle that adds to an overall well-being for ourselves.
Dr. Mann, to go back a little bit to Dr. Lori Gardner's, and hey, Dr. Lori out there, we've got some great comments out there, but it's a cycle. And it's a cycle that it has to stop now. I think we do something like this, like we got to break it. We got to break the cycle there. So ladies, like commitments and just making that commitment so that we can break the cycle for our children as well.
Yes.
And sometimes I think it takes accountability, like we
Mhm.
always talk about. It takes a village to raise a child. It takes a village to stay a village, I would say. And sometimes, we don't want, we're not motivated, or, we start off exercising or eating right, and then we just don't have that, motivation. So sometimes we just need a partner, a friend, someone to encourage us to continue on, or to walk with us and to hold us up when we say, well, I really don't want to, exercise. I really don't want to, eat what I'm supposed to. I really, don't want to do these things. If you have someone else there that's, kind of in your ear saying, okay, it's just 15 minutes today, or it's just 30 minutes, or just, just meditate, just, do something, in terms of taking a step in the right direction, that may be helpful as well.
Absolutely. What about
I
And
have
mental?
to,
sometimes you just don't want to
I
be
have to,
alone.
I have to interject, and all of you just reminded me of how thankful I am to have gone to an HBCU, because a lot of times we are up against generational patterns in our diet and in the amount of exercise and in the choice of work that we do. But when you go to an HBCU, I can speak from experience. You see that there's no one way to do it. There's a lot of ways to do it. There's a lot of ways. We are a broad spectrum of diverse people with diverse offerings and cultures and different access to these resources. I'm so thankful now that we as a people are beginning to see ourselves in those parts, in the physical, in the mental, in the spiritual. Someone once told me we are spiritual beings having a human experience, and that set the perspective for how they went about seeing life. And when I went to an HBCU, I was a first generation college student in my family, but I had met other people, other students from all over the world that had they were their third generation attending the university, and they had access to education and resources and lifestyles that were far removed from my parents, my grandparents who were factory workers, and their grandparents who were sharecroppers, and their parents who were slaves. And so here we are, 5 generations following. We can see, I'm thankful and blessed that I'll probably outlive my mother, and she outlived her mother, and we get healthier, and we're breaking some of these patterns as we have access to more information. So I think, going back to your other point, Tanya, there's no way we can actually pinpoint why it's such a huge disparity in our community, but we do know we are armed with the tools and the resources now to do it differently than it's always been done.
Absolutely. Absolutely. How do we tie this in? I've seen a lot of comments out there around mental health, and we know, of course, that we know that mental health is tied in with lack of exercise and mobilities. Can we have some discussion around mental health and exercise and well-being?
Actually, I had an appointment with a therapist I've been seeing, just because of everything I have on my plate. And she brought up a very good point to, just this morning, that, what Dr. Mann was saying about accountability. Sometimes you just want to know that you're not in it alone.
Mhm.
And just having somebody just to check on you, like, hey, I might not be able to come to walk with you today, but I'll talk with you while you do whatever, because I have to do, and it might just be somebody you're talking to on the phone, or, oh, here's a playlist, here's something just somebody to encourage you and to keep you going. So that helps, just to know that you're not in it alone, even if that person isn't there physically with you, just to know that somebody is in your corner. A lot of times that can change your whole day, your whole outlook.
Definitely. Very well spoken.
Absolutely.
Absolutely.
And we
Janesa, it's a
also have to
village.
remember that the human body likes to take the least path of resistance. We don't, it's like, oh my God, if I got to get up and I have to exercise, that's going to hurt, or this is going to happen, or that's going to happen. We're prone to taking the least path, the least path of resistance. So it's easier for me to go to the doctor and take the meds and get the prescription and go to the pharmacist. That's easy for us to do. That's easy. That fits in everything. It's not a lot of sweating. That's not a lot of work. But if I ask you to get your meds and let's go walk for 30 minutes, then we're gonna find some sort of excuses. And we gotta also, when Tanya, you said mentally, why do we have the mental block of not making it a priority? And you know what the foundation of feeling well is? Number one is proper food intake. And the saying goes, what we eat, it determines how we feel. A lot of people don't believe that. It's not a myth, it's true. What we eat is the foundation of how we feel, because the food that we put in our bodies determines a lot of things that go on with our blood pressure, our cholesterol, some cancers, a lot of things going on. And the doctor will ask you, well, what you're eating? Are you exercising? So with the mental, the spiritual, the physical, it starts with your eating. And it doesn't have to be, and I'm not talking about going on a certain diet. It's learning blocks. We have to learn what to eat, then we have to learn to move. It's a lot going on, and it's a lot to think about. So if we're not educated on it, or like the last lady spoke, I'm sorry, I forgot her name. We have to have a partner. There has to be accountability.
Mhm.
Has to be somebody that's not going to be that yes person. Has to be somebody that said, we're going to get it in today, no matter what. We have to hold each other accountable. It's accountability.
Definitely so. I think everybody has made some especially valid points and things to take away from this discussion. We've talked about mental health. We've talked about your physical health. We've talked about tying that all together, having accountability partners, also about trying to break these generational curses, because many of it may just be our cultural, backgrounds, and, what we kind of have a deep-seated fear or aversion to, but we have to break out of that to make sure those coming behind us even are able to as Brandy said, to do even better than what we're doing, to make sure each generation is better and better. So sort of reteaching ourselves and those around us as well. Does anyone else have any other takeaways? I think we've had a fantastic discussion regarding women's health and wellness and self-care. Any other comments that anybody has?
I just wanted to add something about medication. It is definitely important to get your prescriptions filled at the same pharmacy. Sometimes when we go to this pharmacy, that pharmacy, we don't have a complete list of the medications you're on, and that includes over-the-counter things, supplements, and anything, herbal you might be doing. Also, when as a pharmacist, when you get something filled, we check those medications against the list we have. So if we don't have an accurate list of what you're on, we can't check for interactions, duplications, things like that. And I'm on the phone a lot during the day, checking things and saying, hey, do you realize this person is taking this? They might be going to the heart clinic and the doctor changes their med and then their regular doctor still has them on something else. So that does happen a lot. So just to kind of coordinate your care, it's important to do it all together. And also allergies. Allergies are a big thing. Just because your doctor might know you're allergic to something doesn't mean that the hospital knows when you go to the ER, doesn't mean that the pharmacy knows. So a lot of times there are a lot of missing pieces that can be life threatening. And I catch things like that all the time. So just make sure you have an accurate, up to date list of your medications with you in your purse or at home somewhere. Make sure it's up to date because things might change from appointment to appointment. But also to get your prescriptions filled together and to make sure that however many doctors, a lot of people see different specialists. So make sure that everyone's on the same page so that you can have accurate, complete care. Because a lot of things do fall through the cracks. So that's very important.
So
Thank you,
absolutely. And as
Kana.
you said, a lot of places don't have the same, everybody assumes because their doctors or pharmacists are on computers that we all see everything. And that's not the case within different systems. So it's not a universal system where you as a pharmacist would know everything that that person has had. So that's very important because a lot of people may not understand that or, be aware of that.
Okay.
Thank you, Dr. Mann. Before we wrap up, I just have to share a little nugget with me that a mentor gave me for really beginning to laser focus on mental well-being. I was given 5 points, and this is really quick. It's something that's easy to remember. I hope it helps somebody. It has certainly helped me over and over again. And the first point is to be encouraged. We know those who have encouraged themselves and needed to find encouragement and to surround themselves with people who were growing them. The second point was this is a new day. Whatever happened before doesn't matter. What's coming, you can't control it. The third was our youth will be restored. And so that is something that's, a matter of faith and of confidence that your youth will be restored. This is a skin suit we're wearing, and you'll have your youth. The fourth point was this is going to be fun. And so you can have a positive attitude about everything and see optimism and wonderful opportunities, even when you're presented with obstacles. And the fifth one was this battle is not ours. We have to understand those things that we can control, like exercise and diet and sleep patterns and hydration. And we have to understand those things that we can't control, like certain diseases that might want to set in or certain tragedies that might fall. But in all, those 5 points have really been my return to for keeping myself healthy and well. And I just wanted to share that with anybody that might be listening, that might find themselves in a hopeless place. It's never too late. It's never, ever, ever too late to do it all over again. Number 2 said, this is a new day. So
Oh,
I just
Brandy,
wanted
I'm about to take off running.
She's preaching, right, Kana? She's preaching.
Yes, yes, yes.
Mhm.
Absolutely. Well,
Yes,
thank you.
thank
that's
you
definitely
all.
going to help
I didn't
somebody.
mean to preach for y'all, but I hope it helps somebody just to remember those things. If you got 5 fingers, you can remember those 5 points and you can get yourself through just about anything. The mind has an incredible capacity to heal the body and to carry you wherever you dream to go.
Yes, yes, yes.
Thank you. Very well spoken. Thank you to all of our panelists.
That's a man.
Yes.
Do you mind if I just share? Because I think it's important that our women out there know that collectively we are a powerhouse. So we've got tons of resources out there. And I think oftentimes, and I'm speaking to my brown and black and brown women out there, we operate in silos, but you have resources. So just on this panel, I'm not going to consider myself a clinical nurse anymore, but you have Dr. Van, who's an OBGYN. So sometimes we know that there's medical mistrust out there. And that's why we have platforms like this so that you can seek care from clinicians that you truly trust and say, hey, I really think that this person's going to listen to me. Dr. Mann is an OBGYN. Now, we're not soliciting, she's not soliciting business or anything like that. But if you need to see one, she's available because you're going to take my coffee partner. So don't too many of you guys go out there. But anyway, and then Brandy has her yoga sessions. So Brandy, you want to talk a little bit more about your yoga sessions?
Yes, absolutely. Right now, I offer workshops to certain nonprofit organizations in the community for free. Whenever I have the opportunity to come and teach about the benefits of yoga to mental and healthy well-being, and so I offer regular group workshops, and as of now, private sessions are available. But mostly, I'm happy to come talk about yoga for free anytime because it is what I do. It has certainly helped me to see myself in a different way than I ever had before, as far as stretching my mental agility to its limit, stretching my physical agility. And one thing about it, like the talk my mentor gave me that says that our youth will be restored. One thing that has benefited me the most from practicing yoga is just feeling reinvigorated every time, and with gentle stretches and gentle kindness and just compassion for my body, for my mommy body, for my 40-something-year-old body, for
Wait, Brandy, so
everything.
brown girls do yoga? Is that what you're telling us? Brown girls
I'm
actually do
telling
yoga?
you, absolutely. Tanya, yoga actually originated on the Eastern Hemisphere of the globe and all those very old places in the world. And so the first people to practice yoga were brown men. And then someone brought it to the West, and sometimes those things can conflict. And I know we have Google, we have a lot of resources that might conflict with what licensed professionals might be able to offer us. It's important to have both. It's important to have licensed professionals in your line of care. It's important to go get those breast exams, ladies, those OB exams. It's important to help go have your health and wellness exams regularly. It is also important to keep up with a routine that fits your body. And so the one thing that I like about yoga is that it is accessible to everybody. 2 words, everybody. You can do it from a chair. You can do it from any weight, from any capacity, using your strengths and your abilities where you are right now. There's always a way to pause and be mindful of the breath and to be mindful of the muscle regions in the body and begin to take gentle stretches. And I tell you, after 3 months of a regular yoga practice, you become a new creature. It's been studied over and over again. There's this German doctor who has a book titled The Body Keeps the Score that I read from cover to cover on how trauma physically affects the body, and how your body just kind of wears it like a tattoo. Different types of trauma, and we're all prone to it just by being human. You fall down, you scrape your knee, you lose a loved one, you have tragedies befall you, and how you respond physically is definitely a part of it's going to be a result of what your self-care routine looks like. And so learning to practice yoga and to teach others yoga, learning about the muscle anatomy in the body and how those things work together was fascinating to me. And so I'm a forever student in that capacity. I'll always be staying on top of those resources and exploring and just enjoying my body right now, because this is the one that's been assigned to me.
Yeah, I have to hook you up with Latoya Walters. I don't know if she's still on, but she loves yoga as well, so I have to connect the two.
Yes, hi Latoya. Good to see you on. I saw you on. Hi Latoya. That's awesome. I'm so happy.
The body takes care of itself, and Brittany wants to remind us of our yearly wellness exams as well. And then Janelle, tell us a little bit about Grace Fit out there.
Grace Fit is just like it says. It's Grace Fit. It's overall training, cardiovascular training, and strength training. I know a lot of ladies, we know about cardio movement, expending calories, because when we expend calories, we burn body fat. But as we get older, we move into that menopause phase. A lot of ladies don't understand weight training. Why is weight training, weight bearing exercises important? Because muscle burns fat. Fat doesn't burn fat. And we also need it for stability and balance as we get older, and strength. Like you said, weight training helps with stabilizing or increasing bone density. During the pandemic, what happened, I didn't weight train because I love cardio. I'm a cardio queen. I can run from here to New Orleans and I feel excellent. But if somebody tell me, Janelle, just sit down and weight train, because of my mindset, that's why I need yoga, because I'm always operating at 100. I need something to slow me down. We have to put it all, we have to do it full circle. Cardio, weight training, and yoga. Cardio, weight training, and yoga. That's your 3 blocks. And that's wellness. Cardio, weight training, and wellness. So basically what I do is, when I first meet someone, I do a assessment on them. I find out where they are physically. I check their BMI. I let them know if they're very lean to unhealthy. Because right now, women, we get on the scale and go, oh my God, I weigh whatever pounds, but we don't understand that your weight is composed of your weight is composed of muscle, fat, and skeletal. Just because you weigh 100 pounds doesn't mean you have 100 pounds of fat. But when you look at the breakdown and go, oh my God, I got this pound, this amount of muscle and this amount of fat, it makes getting on that scale easier. So I train, I do group training. I do individual training. So it's all about what you want, because my training is personalized. It's personalized.
Thank you. And you guys can reach out to both Brandy and Janelle on their Facebook pages. And Candy, you want to leave us with any lasting thing on medication compliance before we turn it over to Dr. Mann?
No, just remember what I said about just try to keep up a list, because there's so many people that have so many medications, they don't know what they're for. I ask all the time, all day, hey, did your doctor change you? Should we take this off? Should we do this? Oh, I don't know. It's like, sometimes things go in one ear and not the other. So, if it's an older person, if it's your parent or an aunt or uncle or whoever, it might be a good idea to go to the doctor's office with them, or when they get that checkout paperwork that has the list of all their medications, take a few moments to go through their things at home. And if it's something they're not supposed to be taking, then take those and put those on the side, do something with them, because a lot of, especially older people, they're so confused and they don't know why they're taking what they're taking, and they're taking duplicate things. So if you can reach out to someone, it might be a neighbor, it might be a family member, a lot of people don't have the help. A lot of older people are alone. They might be confused. They don't know the names of medications or what they're for. So if you can help someone, please do that. Please reach out and do that, because I see that too much.
Thank you all, ladies. I think everyone has shared very important concepts about our health and our medication compliance and our physical and mental well-being, and making ourselves a priority as well. So I'd like to thank all of you. We only can thrive when we can thrive together. So appreciate all of you as well as all of our viewers. And we look forward to continuing on and have other thriving sessions. Thank you and have a good night.
Thank
Good
you
night.
so much, Dr. Mann.
Good night.
Thank you.